When most people think about healthcare, they picture the doctors in white coats, the nurses who somehow manage to be everywhere at once, and the patients who, let's be honest, probably don't want to be there. But what if I told you the most powerful force in modern medicine isn't a new drug, or a breakthrough surgery, or even a genius surgeon? It's data. Every single beep of a heart monitor, every prescription written, every lab test, every time you check your blood pressure, or your Fitbit reminds you that you're behind on steps. That's all data. And collectively, it's creating one of the most complex and valuable data sets in human history. The average hospital generates around 50 petabytes of data every year. That's about 12 million DVDs. Think about that. Every shift, every patient visit, every billing claim, data is flying everywhere. But most of it just sits there, unused, buried in siloed systems, or worse, in someone's clipboard that never makes it to the system at all. That's where healthcare analytics comes in. It's how hospitals, clinics, and research institutions make sense of this tidal wave of information. In simple terms, it's the process of turning messy, disconnected, overwhelming data into something that actually saves lives. Let's walk through it. When a patient comes into the hospital, they generate dozens, sometimes hundreds of data points. Vital signs, lab results, medications, doctor's notes, discharge summaries, insurance claims, even data from wearables like Apple Watches or glucose monitors. All that goes into an EHR, or electronic health record. That's basically the system of record for a patient's entire health journey. Then that data can be extracted, combined, and analyzed to find patterns. Patterns that might tell you which treatments are working best, which patients are at risk, and where the system is wasting resources. Healthcare analytics, like most analytics fields, happens in layers. First, you've got descriptive analytics. That's the what happened layer. Think of it like a hospital dashboard. How many patients did we admit this month? What's the average length of stay? Then there's diagnostic analytics. The why did it happen? Level. Maybe readmissions went up because discharges happened too early, or follow-up calls were missed. Next comes predictive analytics, which is where it starts getting exciting. This is where data scientists build models to estimate what's likely to happen next. Which patients are most likely to be readmitted? Which surgeries carry the highest complication risk? And finally, prescriptive analytics. This is the what should we do about it layer. It's where recommendations, interventions, or alerts get built into clinical workflows. Here's an example. A hospital might analyze historical data to predict which times of day or days of the week are likely to be busiest. Or they might identify which types of patients are at highest risk of readmission, say diabetic patients discharged without a nutrition consultation. When you can predict those patterns, you can act before the crisis hits. You can staff smarter, plan better, and treat patients faster. That's not just efficiency, it's care. And here's the important thing. Healthcare analytics isn't about replacing doctors with machines. It's about giving clinicians superpowers. Think of the data scientist as the hospital's co-pilot. The physician knows medicine, the data analyst knows math, and together they can see patterns that neither could see alone. And like realizing a spike in infection rates isn't because of a bad flu season, but because a certain wing of the hospital has a ventilation issue. Or discovering that patients in one zip code have consistently higher rates of hypertension, not because of genetics, but because of poor access to healthy food. The best analytics doesn't live in spreadsheets. It lives in decisions. It lives in how hospitals allocate beds, how pharmacies track drug shortages, how insurers identify fraud, and how public health departments spot outbreaks before they spread. In other words, healthcare analytics is like a digital nervous system. The sensors are everywhere, monitors, charts, claims, and analytics is the brain that interprets it all. Let's put it in metaphor terms. Analytics is the hospital's digital stethoscope. It helps the organization listen to itself, to its own heartbeat. And just like a doctor listens to a heart to detect early signs of trouble, analysts listen to data to detect the early signs of systemic issues, bottlenecks, inefficiencies, errors. When the system listens, it learns. And when it learns, it improves. At the end of the day, all of this data transformation, cleaning, modeling, forecasting, it's not just about charts, it's about people. Every row in a data set represents a person who's hoping the system gets it right. Every line of code written in a hospital analytics department, every model tuned to reduce error, has real-world stakes. And that's what makes healthcare analytics so uniquely meaningful. It's where math meets mercy. So in this series, we're going to explore the full landscape. Everything from EHRS and predictive modeling to population health, cost analytics, fraud detection, and personalized medicine. But next up, We're tackling the data source that powers it all: electronic health records. Spoiler alert, it's both a goldmine and a mess. If you're enjoying the series so far, hit subscribe, drop a comment, and join me as we explore how healthcare data becomes healthcare intelligence. Because at the end of the day, data doesn't just describe life. In healthcare, it saves it.